Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Through this monthly program, we bring you information about Franklin County Home Health Agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. Franklin County Home Health Agency is our local nonprofit home health care organization that has been providing home care and hospice services to people of all ages throughout the 15 cities and towns of Franklin County since 1969. Thank you for watching today. On today's program, we'll be talking about dementia care and resources for people living with dementia and those caring for people living with dementia right here in Franklin County. And to help me do that, I've invited a medical social worker from Franklin County Home Health, Amanda Wilson.
Hi, Jen. Thanks for having me.
Thank you. Thank you for being here.
Sure.
So in addition to being one of our skilled medical social workers, Amanda works as a professional community educator. You volunteer as a professional community educator with the Alzheimer's Association of Vermont.
Yep.
You are currently a UVM graduate student with an internship as well with the Alzheimer's Association. So very busy. So I appreciate you taking the time to come and talk with us about what you're doing statewide and what you are doing locally here in Franklin County. So thank you.
Thanks again.
And we're talking about Alzheimer's disease, other dementias, and resources here. So a quick little bit of statistics about Alzheimer's disease in America. Over 5 million Americans are living with Alzheimer's, and it's projected that as many as 16 million will have the disease in 2050. And locally, or not even locally, but nearly 1 in every 3 seniors who dies each year has Alzheimer's or some sort of form of dementia. So this is a huge epidemic, if you will, that's coming down on our nation and locally. So let's talk about what we do here in Vermont to meet those growing needs and what we do locally. But before we do that, let's talk a little bit more about you, Amanda. Tell me about your experience at Franklin County Home Health Agency as a medical social worker.
Sure. So I've been working with Franklin County Home Health for almost 3 years now. And then beyond that, I've been in the healthcare community here in Franklin County for about 8 years. So my experience working with people with dementia and those affected by it has been pretty wide, and it's been happening for a while. I first became kind of exposed working in long-term care, but that has transcended and grown in the work that we do with Franklin County Home Health. I think it's become kind of a passion of mine and an interest because it seems like people with Alzheimer's disease and their caregivers are almost the underdogs. Alzheimer's disease is winning. There were huge movements for AIDS research and awareness and cancer, but we haven't had that yet for Alzheimer's disease. I think that movement is coming, and I want to be part of it.
Yeah, excellent. Yeah. That's so true. You said, just really quick, that you've been doing some work for the past 8 years locally and as a social worker in different capacities in our community, or?
Yep, I worked in a long-term care setting as a social services director, and I've been with Home Health as a medical social worker for about the past 3 years, and that's where I plan to stay.
Yeah, what do you like about home care that makes you want to stay there?
Oh, I love working in people's homes. I think the greatest thing is that you're a guest in their home. Whenever I enter someone's home, I thank them for having me. It's truly an honor. I think in social work, we really strive to provide person-centered and strength-based care, and you have the opportunity to do that when you meet with someone in their home. You really get to know who they are, the context of what's going on in their life, what is important to them, what their values are, and that all impacts their health care.
Yeah, wonderful. So since you're talking about that, what, we are focusing today on your work with dementia and your patients you may see in home health or people that you contact with your work with the Alzheimer's Association and in our community. But what does, just to back up a little bit, what is a medical social worker's role in home health care broadly?
Sure. So the social worker role is quite broad, which is great. We visit with people in their homes in various capacities. The social work team does short-term home care for people maybe coming out of the hospital with a fracture or something new has happened and they need access to resources. We work with folks and their families on long-term care programs, so we'll work with them throughout their lives. keeping them connected to resources and safe at home. And then we also are part of the hospice team.
Yeah, okay.
So we work with folks at end of life. And caring for and engaging with people with Alzheimer's and dementia is happening in each of those areas.
Mm-hmm. Sure. Whether or not they're on hospice yet or not, you have instances where you are caring for people with dementia.
Yeah,
Well, people think Alzheimer's immediately. No, I shouldn't say that, but often when you think of dementia, what other conditions or something where just dementia arises?
Yeah, so the terms are sometimes used interchangeably and people can become a bit confused. So dementia is this global term that really refers to a set of symptoms. So if I bring my mother to the hospital and she's confused and she has memory loss and she's having problems with thinking, she has dementia. And then we need to figure out what's causing that dementia. So a UTI might actually cause dementia, and then it could be reversed. But there's lots of different types of dementia. So Alzheimer's disease is one type of dementia. It's the most common form of dementia, and most research is in that area. Research and strides that happen with Alzheimer's can be applied potentially to other types of dementia. Vascular dementia is caused by stroke. There's Parkinson's related dementia, Lewy bodies dementia, so there's various types, some reversible, some not.
Sure. So some are caused by conditions, maybe a symptom of a condition. Mm-hmm. Others grow, like as with Alzheimer's, you
Right.
receive that. Can you, knowing what you do through the Alzheimer's Association, all your expertise there, can you talk a little bit more about recognizing Alzheimer's versus those other conditions and how that actual disease progresses?
Sure. So it's really important when someone has symptoms of dementia that there's further assessment and they go to their doctor and really figure out what's going on. Is it something that is reversible or is it perhaps Alzheimer's disease? Alzheimer's disease specifically is progressive. It's a degenerative disease of the brain. There is no cure, no treatment. It causes problems with thinking, memory, and behavior. So there's a whole variety of assessments that need to be done to truly diagnose Alzheimer's disease. But it can be done locally in your primary care office.
Mm-hmm. If you're having the right conversations with your primary care physician.
Yes.
And having somebody to speak with for you or with you, I'm sure.
Yeah,
is
having
a
an
huge help.
advocate.
Mm-hmm.
Yeah, that's really important.
So there are talking with your doctor, as you said. Before we get into the actual resources, talk some more about what challenges an individual faces when they've been diagnosed with dementia or Alzheimer's, and then what challenges the family's feeling or what they're coping with.
Yeah, it can be difficult. When someone receives a diagnosis, they often don't know where to turn. Family members are left alone to kind of fend for themselves. Thankfully, there's agencies like Home Health and some others in the community that can provide a lot of supports, and I think we'll talk a little bit about that. Some of the challenges are the type of care that people are providing to their loved ones when they have Alzheimer's disease is more physical and more emotional. So it takes a greater toll and it takes more skill. It takes a different kind of tool in your tool belt to provide good Alzheimer's and dementia care. The resources in the community aren't as great as maybe they should be, or they don't fit quite right. The cost of care is so expensive. It's $20 to $30 an hour to pay privately for an hour to have someone in your home. And I don't know a lot of people who can afford that.
Sure. Yeah.
Caregivers, both in the homes and professionally, I think could use more education on how to do this care and do it well. Again, those tools in the tool belt. And I think the lack of caregivers is a true fact. There are not enough caregivers out there to hire privately or professionally for any agency.
Sure. And when you talk
hard.
about caregivers, I just want to differentiate between medical care givers and what we're mentioning when you say paying for private care. So if you've been diagnosed with a condition like Alzheimer's and you have other physical ailments and things going on, you may have hospital visits, doctor visits, you may receive home health care for reasons. What is the difference that you're talking about when you say caregivers right now, about paid and unpaid? And
I think for agencies, for long-term care facilities, there's not enough people in the world, in the community, that are equipped or want to be a caregiver, be a physical care provider, or even companionship, because the work of working with people with Alzheimer's disease and other dementias is really hard.
So demanding.
Yeah.
So these are people who do not need to be a nurse or a therapist or social worker. We're talking about the other part of the team. So we're talking about somebody who can give the family respite, somebody who maybe is in lieu of family, who's even available. So many of our elders are living alone. We don't have that family staying in the same community structure we may have in the past. So you're really talking about individuals who could be giving a little bit more to somebody in need. That's a huge impact on their safety and their wellness, but you're saying that they need the skills and the numbers need to be there.
People are stretched so thin these days, and the other challenge is we are a society and a culture that values independence. So, and I talk with people in the homes often about, well, let's just imagine that it were better to be dependent on other people. When you hear the word dependent, you think negatively, that I can't do it myself and I'm not good enough. We've just created that. So we could very easily change that and value interdependence and the need for one another. And if we did that, we would have connections with our neighbors and our community groups and folks at the library and the church group down the street. And those would be potential caregivers that would be available.
Not be afraid to ask and not be afraid to step up on the other end.
Having those relationships.
Yeah, that's a great point. I'm glad that you start those conversations with people. I may be jumping around here for a second, but it made me think about, you're talking about working with somebody who's living at home with dementia, who's being forgetful, who's maybe not thinking clearly, and you're talking about having advocates for them. Because at what point do you start making these decisions about who will be my caregiver, who makes those decisions and when? In any of our lives, we don't know if we're going to come down with a condition like Alzheimer's or a short-term or long-term dementia. So what do you say to folks about being prepared?
I'm really glad that you brought that up, because Franklin County Home Health is part of the Start the Conversation project. And Start the Conversation is this opportunity to start talking about your long-term planning, your advance directives, power of attorney, making decisions ahead of time. It's never too soon to prepare for that. I've done my advance directive. I'll say I'm 35 and it's done.
Good.
You can do it and you can revise it and change it over time. It's never too soon. And some people are afraid, if I do an advance directive and I appoint a power of attorney, I'm giving up my power. And I'm always telling people, you're not ever. People always have the right to make decisions as long as they're able and they want to. Having those are just a backup for, God forbid, something happen and they can't make their own decisions.
And then as Start the Conversation promotes, that person, your power of attorney, you will be having conversations with. You ought to be, that they really understand where you're at today on the type of care you would seek should you become incompetent making those decisions. But up until that point, you can change your mind and you can talk with them and be having those conversations, and that's good. So you're talking about some of those challenges, the cost, the lack of support, or the tool belts in people's. Talk about education for professionals and other issues that are challenges.
So having professional caregivers be educated about how to provide Alzheimer's related care is a challenge. Alzheimer's disease is relatively new. It's not new, but in the healthcare field, just talking about it and acknowledging, when someone is having challenging behaviors in a hospital setting, recognizing what that is and how to approach a person. So if we were all more equipped to provide the appropriate care, we'd have better outcomes. As a professional community educator, I offer these programs through the Alzheimer's Association free of charge in various areas of the community. Someone can just call and request one at a community organization. It can be provided. And we're working really well at Franklin County Home Health right now, collaborating with Janet and other management team members to improve and constantly be providing our staff more education and those tools, so that when you're better equipped to provide the care and you have the right tools in your tool belt, it's not as hard anymore.
Good. And so when you talk about sharing that, you're sharing it with your staff and your team at Home Health, but you're saying other local Franklin County agencies or surrounding can say, we really need somebody to help us train our staff on some particular issue, they can call you and seek that resource. And I imagine there's a whole host of other community educators through the Alzheimer's Association that could reach out in different parts of the state.
Yep, in different parts of the state. Fortunately and unfortunately, I'm the only professional community educator right now in Franklin County, though hoping with some of the coalition efforts that we'll talk about, we'll get more educators. I've done presentations at some of the SASH locations. And the SASH is the program that helps folks remain in their homes. So Weldon Villa or Four Winds, some of those locations. And I've done presentations at assisted living facilities. I do them frequently at the hospital. I've done them right at our agency at Home Health for our staff numerous times.
Yes, wonderful. What about some more for caregivers who are currently right now caring for a loved one? Are there support groups for them in addition to your kind of education, but support groups?
Yep, right now there is a newly forming support group here in Franklin County the last Tuesday of every month from 6 until 7 at Northwestern Medical Center, and I'll be facilitating that. There's quite a few people who have expressed interest, so I'm glad that that's something that we'll be offering.
Good, I imagine it is.
And that's specific to Alzheimer's disease, Alzheimer's and dementia caregivers. I just want to specify, it's through the Alzheimer's Association, and they do ask that it is for caregivers only, so they really have a safe place to talk openly about what it's like to be a caregiver.
Yeah, I can talk personally. We had, my grandmother had Alzheimer's disease, and I understand that need to have someone watch her for a while and have the spouse or somebody come and talk about what's really on their plate, and like you said, be safe to do that. It's a huge resource for families, so I'm glad to hear that's happening. We will be sure to post the dates and times and everything on our website. At the end, I'll remind folks how to find that information. Great. So let's talk about another new thing happening locally, which I think you're excited to talk about, and that's the coalition. Talk about the Franklin County Dementia Care Coalition.
Yeah, so it's great that we're transitioning, because one of the things that you mentioned was the support group, and having someone stay at home with your loved one while you go to a support group. So these nationally created services, for example, through the Alzheimer's Association, support groups, educational programs, the helpline, or the online resources, they're wonderful, but they don't always fit with places like Franklin County. So a lot of folks can't go to a support group because they don't have someone to watch their loved one, or they can't access those online resources because they don't have Wi-Fi or internet access where they live. They may not even have cell service. Transportation can be an issue. So what the coalition is doing is it's a group of people, small group of community members that's come together and recognize that we can do a better job at providing Alzheimer's and dementia care in our community, and we want to figure out how to do that. So that's what we're working towards.
That's your goal, gathering what's going on right now and what are we going to do next. Good.
Yeah. Yep.
So how are we going to kick that off?
So right now the coalition is developing. It's about 10 or so members, but it's literally growing every day. We have friends and family caregivers, business owners, students right here locally that are involved. We have healthcare representatives from Franklin County Rehab, Franklin County Home Health, Brownway, CVAA, Care Partners, the Adult Day Program. So people are really buying in and getting involved. We have resources that we're building that are local, and we're offering some events and trying to get education and awareness out there to bring more people in. Our goal is to assess the needs of Franklin County and then figure out how to tweak or develop programs and resources that specifically meet our needs. So that helpline, for example, is a really wonderful resource, but not everybody feels comfortable calling a national organization. So one of the things that we're very excited to do is just collaborating recently with Franklin County Home Health, and we're being sponsored to cover the annual cost to have our own local helpline. So people can call someone, maybe they know their last name, or you know that they are where you're from and they understand what you're talking about. And you can ask questions, get support, be referred to resources. And I think that that's going to be a huge support for our community.
They'll know the local resources, if it's a nice fit for you and your situation, and it's so nice to have that localized attention. And it's good to hear that that's happening here. I did take a peek at the website that you guys are starting, your own website. Again, I'll put those links online, and I had that here. What is it? It's the initials.
It's FCDCC.org, so Franklin County Dementia Care Coalition.org. And that website is thanks to Morgan Bovet at Brownway. They sponsored and put together the website for us. There's a lot of educational links. We're going to have calendar links. It's kind of still in the making and growing, but people can absolutely check it out. If you want to get involved in different ways, you can click and it will direct you to the email of the person that's leading that cause.
Very cool. Yeah, I did peek at it. There's a place to share your personal experience. There's videos, education, different links. It's a very well done. It's really nice. And then you also are on Facebook, so people can stay very active on what's new.
Yep. Facebook is a great place to get connected and share information. Any of our upcoming events will be promoted on Facebook. We have Tuesday caregiver tips that are going to be posted weekly, and there's been some really great TED Talks that are being shared. So what we want to do is really expand and try to reach out to people in many different ways so that we're connecting with everyone the best that we can and get information so that we can get that true assessment of what the needs are.
Wonderful. I think it sounds like a super league of care providers here in Franklin County that you're putting together.
It's feeling like it. I feel like I'm wearing a bit of a cape today. I'll be honest with you. I'm flying all over.
She doesn't stop. She's a true home health staff in rain and wind and everything you get in one day.
That's what we do with home health.
That's awesome. So take us back a little bit. I love hearing about the local resources and partners. Could you mention, I know there's the Care Partners. How does Care Partners fit in as a resource for people?
Yeah, so Care Partners, big place in my heart for Care Partners. They will be joining the coalition as members. Care Partners is an adult day program here locally, and there's various funding sources that can help support people to go there. It's primarily about an 8-hour day, Monday through Friday. They provide activities, healthy meals, socialization. They have nurses on staff to help with medication. They have trained staff that can help folks in and out of the bathroom if they need that. It's a really wonderful place where at-home caregivers can get a break and have some time to either go to work or do some of the things they need to do, and people, whether they have Alzheimer's, dementia or not, can go in a safe environment that is really custom to their needs. There's really something for everyone there. It's one of my favorite places to go.
Oh, good. That's great to hear. And again, I know they have an open house coming up, so we'll share some of that information on our website as well. We talked a bit about hospice and home health care. I just want to cover quickly, not everybody who's diagnosed with dementia is going to follow through and go on hospice, but since you've worked as a social worker through hospice, can you talk about when to have that conversation about hospice care and remind folks what hospice care is and how to access it?
Yeah, I think that that's a great conversation to have. So hospice is really a benefit. It's a way of providing care that focuses on comfort, dignity, and quality of life. It's a type of care that's provided when someone is determined by a doctor to have about less than 6 months to live, and they have a life-threatening illness, and they don't want to pursue treatments anymore, curative treatments. So with Alzheimer's and dementia, the qualifications actually for hospice care can come much sooner, and you can be eligible for that type of care much sooner in the disease process as compared to cancer or some other terminal illness. Some of the benefits of hospice care is it is truly patient-centered and focuses on dignity, quality of life, and preferences. So if a person really wants to be in their home and not go back and forth to the hospital, which can be very traumatic and disruptive, especially for someone with Alzheimer's disease. So when we think about how the brain is affected, the short-term memory is most affected so early on. people do better with routine and structure and familiarity. So every time you take someone out of that, it disrupts their mind, their emotions, their physical being. So often for people with Alzheimer's and other dementias, hospice is a great service to provide to focus on the things that are important to them.
Good point. Thank you. And so they can just talk with their physician, and of course it's easy to call our agency and then talk about how to be referred, and our intake department helps you from there.
Yeah.
So Amanda, we're about to run out of time. What else would you like to add before I close?
I just want to encourage people to get involved. I think the collaborative work that we're doing here in Franklin County is really astounding. I'm really proud to be part of this community. There's so many changes that are happening, focuses on health and well-being and partnership and improving care provisions, and everyone can get involved. I recently did a workshop at Northwestern Medical Center, and I said to the audience, they are the professionals. They're the experts. These caregivers in the homes and the people living with the disease, they know better than I do. We want to hear from them. We don't want to just choose what's best and project it on people. I want to know. We want to know
really
what people need.
people-centered. Yeah.
Yeah, and everybody can get involved.
Yeah, excellent. Well, thank you for getting involved statewide and for getting involved locally here.
Thanks for having me.
You. Thank you for being here. And thank you for watching. We are excited to share this information. As I said, we have all this information, the links will be on our website at www.fchha.org, and of course you can like us on Facebook and find some information there as well. I also just want to let you know that we do have job openings at Franklin County Home Health Agency, and you could actually join Amanda on the wonderful medical social work team. There is a social work opening as well as some licensed registered nurse openings and rehab. So you can call our office at 527-7531 and speak with Ann to learn about working with the home health care team. And you can call our agency at any time at the 527-7531 number to talk with how we can help you and your loved one stay safe and healthy at home. Again, thank you for watching today, and be well.